Thanks, Brandis. Concerns about students returning to classrooms come as the FDA has expanded the emergency use authorization for Pfizer's COVID boosters to children aged 12 to 15. Meanwhile, a British study finds that people who contracted the Omicron variant were about half as likely to need hospital care as those with Delta. Joining us now with more on all of that is Dr. David Slade, Associate Medical Director of Infection Prevention Control at Loyola Medicine. David Slade, thank you so much for being here. First, as many of the area school kids go back from winter break today, a lot of parents and staff are concerned over whether schools are safe for in-person learning. What does the medical data say?
Yeah, Paris, thank you so much for having me tonight. And, I have 3 children of my own, so this is certainly a very important topic. And I think we have to start by looking at the risk, the overall risk to our children. We know that traditionally children have been in a lower risk group overall for severe effects of COVID-19. But we're seeing with the Omicron variant, extremely rapid spread right now, and we are seeing increased rates of hospitalization even in children. What I can say is that still the best protection for our children and for the population as a whole is vaccination. So if your children are eligible, I would highly recommend to go out and have them vaccinated right now. We're seeing very good rates of vaccination in the older adults, but now is really time, I think, to make a push for the population as a whole. So that's key, having our students vaccinated, taking stock, as we look at the rates of hospitalization. But I think the overall risk remains low to our children right now, even lower if they're vaccinated. When we're looking at, these decisions about going to school, wearing masks versus staying home or remote learning, those decisions I think will have to be made based on the particulars. If there's, a very high rate of outbreak in a particular classroom or a particular school, then that may be some incentive to change.
And and that's what school officials have said they're going to do, go classroom by classroom on this. Speaking of vaccinations, the FDA did just authorize the booster shot for kids aged 12 to 15. What should parents and kids know about that?
That's right. Yeah. So the FDA looked at the safety of the booster shot in that age group based on some data that came out of Israel recently. They looked at about 6,000 children who had received the booster dose, and it appears to be very safe, no added risks. We're seeing in the population as a whole an added benefit to the booster in protection against Omicron. So I think, a lot of incentive to go out and get the booster right now. And as I think you mentioned, it's now authorized for 5 months after completion of the vaccine series.
And Dr. Slade, a British study just came out determining that people who contracted Omicron are much less likely to wind up in the hospital than if they contracted Delta. Is that proof positive that Omicron is a less severe variant?
Everything that I'm seeing right now supports that. I think Omicron, it spreads much more rapidly, but overall, it is less severe. I think there's strong indication of that. Now, when we're seeing this huge influx of people into the hospital, we're seeing the ability of the virus to spread so rapidly almost outweigh that factor that it is less severe. So we're just seeing so many more people infected right now. Again, vaccine is our best protection, and still the majority of patients being admitted to the hospital are unvaccinated.
So maybe offsetting factors, far more contagious, but perhaps less severe. Does that mean you anticipate a steep drop-off like South Africa saw?
I do. I really do. It's really hard to predict or to say with certainty, but looking at the way we saw it drop so quickly in South Africa, I think we're looking at a very rapid spread over, perhaps a 4-week period, just very, very rapid spread. And it should, at about 4 weeks, decrease substantially. And that's my hope.
Do you think this is the last variant, or will there be more variants to come? There was a Forbes article talking about the prospect of living with COVID for the time being. What are your thoughts on that?
Right. Every time we try to speculate, I've been surprised, with this, sort of rapid spread and the percentage of the population affected. My instinct is that we're really heading towards sort of the end game with the complete pandemic phase of this and more towards the endemic. If we look at past pandemics, if we look at endemic influenza, it has continued to circulate in the population for a period of time. It has been a regularly circulating virus, but I think we can expect perhaps further variants, further mutations. Hopefully they're less severe. I think it will always be there to a certain extent, but not to the extent that we're seeing here right now, not by any measure.
Hopeful words there, perhaps the beginning of the end of the pandemic phase, as you said there. As you know, the city implemented its indoor vax policy today. Do you think that could curb the spread at all, or is that wishful thinking, given what's happened in New York City and the breakthrough infections we're seeing?
Right. I really support it. I think it's a really important measure. It by no means will lead to any, sudden stop in the spread of the virus, again, with just an extremely rapid spread. What it will do, I think, is just provide further protection, further peace of mind for people going out to restaurants. If you are vaccinated, you're substantially less likely to have a severe case, to be admitted to the hospital, and it provides protection against those severe cases and against death. So I think it's really important. It should help to slow the spread, but more than anything, I think we just need a substantial portion of the population vaccinated, and I think really getting that message out is extremely important.
And you see hospital officials everywhere talking about this, that the vast majority of patients they see for COVID are unvaccinated or don't have a booster, and the vast majority of those in the ICU are unvaccinated. Is that what you're seeing at Loyola?
Yeah, I was just working in the hospital for a couple of weeks. I just finished up a few days ago, and that really is still what we're seeing. There are some breakthrough cases. I think if you read reports from around the country, you're seeing between 70 to 90% of the patients admitted to hospitals or in ICU level care are unvaccinated. I think at this point, we're at a point in time where we've seen a lot of vaccines given. We have a lot more assurances as to the safety of it, especially the long-term safety over several months, since this all started to a year, which is just further reassurance and further incentive to go ahead and get the vaccine.
All right, Dr. David Slade, we'll have to leave it there. Thank you so much for joining us.
Yeah, thank you so much.